Do you think that's what employers are doing? I'm just trying to figure out why they decided stem cell therapy was the solution, as opposed to, hey, before you have surgery, you're going to have physical therapy.
Correct.
You're going to have to try other proven therapies. Why stem cell therapy? I don't get it.
I think well, first of all, there's really good marketing. So there's somebody out there selling what appears to be a new therapy, as you've been calling it. And part of the problem is when we call something therapy, people rightly believe that it's treatment. And treatments are usually reviewed and approved by the Food and Drug Administration. There are protections in place to make sure that things that are sold to us as patients and used on us in healthcare have gone through a process that shows, first, they're safe, they don't harm us, and second, they actually do what is purported. They're effective. And that's just not true in this case. And so I think it's actually a situation where patients are paying, or somebody's paying on their behalf for them to be guinea pigs. And that's just not the way healthcare is supposed to work in this country,
And I
or
can
in
agree
any
with you
country.
more. I guess what I'm also trying to figure out is the business relationship with these stem cell providers, because this isn't cheap. So to go have stem cell therapy, it's $1,500 to $9,000 for this treatment.
Wow.
So that's by comparison, a typical surgery might be $19,000 to $30,000. So you can understand the company's incentive there. But it's not a cheap experimental treatment that they're actually funding. So I'm always wondering, well, what's the kickback? Like, what's the relationship between that
feels
self-insured?
shady.
Yeah,
It does.
seems very shady.
I mean, when you get into that amount of money, the high end for stem cell versus a scope to repair a torn meniscus, they're going to be relatively close if you're on the high end of stem cells. So
Are there, in your opinion, shady elements to these relationships?
It does seem shady to me too, but we can't really know until there's some more transparency. So that's, I think, part of the answer here, that people need to have transparency when they're dealing with their healthcare, and especially when their employer is providing insurance for them, that they need to be able to understand what it is that they're being offered and why.
Well,
So Dr. Kahn,
thank you.
to that point though, do you have any other discrete tips for people in this situation, if this is what their employer covers, how people can protect themselves?
Well, for one, I would say that people should ask, what's the standard of care for this particular diagnosis? And I don't think ever would it be the case that an experimental stem cell therapy is the answer. Number two, who's making the judgment that you as a patient should go to the stem cell clinic rather than to an orthopedic surgeon or whomever is the appropriate physician for the particular injury or the complaint that you have, and ask for information. People have a right to that. And as we heard earlier, people have a right to make decisions for themselves about their health care. That's informed consent. And that doesn't seem to be served in this case.
Well, thank you, Dr. Kahn, for joining us. And I want to clarify that no one here is saying that there isn't a place for stem cell therapy, and no one here is saying that there isn't continued hope in the future for these treatments, but always buyer beware when it comes to any treatment that promises the sun and the moon. Usually you're not getting the full story